Thank you. Mrs. Miller, you're recognized.
Thank you, Chairman Buchanan and Ranking Member Doggett, and thank all you all for being here today and taking the time to speak with us. I'm from West Virginia. Of West Virginia's 1.7 million residents, 1.2 million live with at least one chronic disease, and more than 527,000 manage two or more. This is an alarming burden for a state of this size. For these chronic disease patients in rural West Virginia, pharmacists are not just someone who fills their prescriptions. They are often the most accessible and trusted healthcare professionals for patients managing chronic conditions like diabetes, hypertension, and heart disease. Independent pharmacies, for this reason, have long served as a frontline access point for patient cares in rural communities. I remember when my children were little, I often would talk to the pharmacist before I'd ever bother to call the pediatrician. Unfortunately, as we know, many of the pharmacies are closing at an alarming rate. Ms. Reichert, can you speak on how pharmacists have stepped up as community providers in rural areas and how federal recognition of pharmacists' clinical services could actually help stabilize these businesses and preserve access to care in communities like mine?
Yes, thank you for the question. Pharmacists are an underutilized healthcare resource with training and clinical abilities to reduce ER visits, hospitalization, and increase quality of life for patients. When pharmacists are empowered to provide preventative care, we know that hospitalizations and readmissions goes down. ECAPS legislation helps Medicare to spend smarter. It shifts cares from ER to accessible community-based settings where we have access to care for our patients who may otherwise go without. In the rural area where I'm from in Southern Illinois, the nearest emergency room is 30 to 40 miles away. And I gave that example in my testimony. Patient comes into my pharmacy. That's the best option I have to give them is say, oh, you think you have the flu? Go to the emergency room. That's just not sustainable. And I know as a healthcare provider that that's not cost effective either. If we could provide these services and be empowered to provide these services for our Medicare beneficiaries in our own communities, I really do feel that we could make an impactful difference for them.
Thank you. A particularly vulnerable group of chronic disease patients are Americans that are living with kidney disease and kidney failure. Later this week, Representative Sewell and I will be introducing the Kidney Care Access Protection Act, a bipartisan bill that takes important steps to stabilize the kidney care system while we work toward broader payment reforms. This legislation ensures patients can continue receiving high-quality care and innovative new treatments can actually reach them without delay. Dr. Hoban, chronic kidney disease management hinges on patient education, diet, medication adherence, and blood pressure control. Can you discuss how innovations in care delivery, including education programs or digital health tools featuring multidisciplinary care teams, might actually strengthen patient engagement and improve kidney health outcomes in underserved areas?
Absolutely, and thank you for the question. You're right. Chronic kidney disease is a crisis in this country due to downstream effects from high blood pressure and diabetes. And I think one of the main ways we tackle that is the collaborative care that Ms. Reichert talked about. So those patients need wraparound care with diabetic educators and with nurse care managers and partnerships with pharmacists and partnerships with nutrition, all on the education side. And access to that is easily done virtually. So they can connect to those providers in a virtual way and then leave to the physicians the more complex decisions that need to be made around further management. I think it'd be remiss to say we also need to get upstream of it. So you talked about that in your community with the 1 to 2 chronic diseases in so many of your constituents in Western Virginia. We have to get upstream and prevent the progression of the diabetes and the high blood pressure. So remote patient monitoring, sending that data back to a care manager who can assess that and then elevate it to the level that if there needs to be management to the pharmacist or the physician to help manage those decisions on the next best treatment. If we've already maximized lifestyle modification, the care model has to be collaborative and it has to be top of license work for each one of us who are providers in the healthcare system.
Thank you. I yield back.